Exclusive investigation of COVID antibody tests. As coronavirus cases top 5 million worldwide, we worked with the Mayo Clinic to examine the accuracy of so many different brands on the market right now. Eva Pilgrim has the results. Good morning, Eva.
Good morning, George. As the country starts to reopen, these tests are seen as a crucial element to reopening safely. But this morning, Mayo Clinic researchers say not all tests are created equal.
This morning, a joint investigation by the Mayo Clinic and ABC News. Researchers at the clinic concluding that many of those COVID-19 antibody tests flooding the market shouldn't be trusted. 4 out of 9 quick finger prick tests examined by the Mayo Clinic deemed not up to medical standards. One test even giving a positive result for COVID-19 antibodies when, as you can see in this video, only saline, not a blood sample, was added. An automatic fail.
So clearly there had been a mistake in how that kit was constructed.
Mayo Clinic researchers found more sophisticated tests using a full vial of blood sent away to a laboratory fared better, but only slightly.
Out of the 10 test kits that we looked at, there were 4 that really had, A+ ratings. There were a couple that were in the B range, and there were 3 that were definitely in the F range we wouldn't want to use in the clinical laboratory.
So what antibody test, if any, should you choose? What's important, the Mayo Clinic doctors found, is authorization from the FDA, specifically for testing COVID-19. Out of over 200 tests on the market today, only 12 have been given the FDA's emergency use authorization. But how is the average person curious to see if they have COVID-19 antibodies supposed to figure out which test is authorized and which isn't? The Mayo Clinic says don't take this on yourself. Work with a medical provider.
I would just ask the doctor if they could confidently say, yes, they did have the COVID disease if the test was positive, and no, they did not have the disease if the test was negative. If they can't answer that confidently, then I would be a little bit concerned about the test that they were using.
This, as a new study out of Emory University finds antibodies could mean some level of immunity. Emory scientists discovering a specific virus-neutralizing antibody in hospitalized COVID patients within 6 days of testing positive.
What our test does is not only shows that you've been exposed to the virus and have made antibodies against it, but those antibodies, at least to the extent we've tested now, seem to correlate with blocking of viral infection.
Researchers say there are still unknowns.
So at this point, we don't know how long people would be immune.
I think going forward, it will be important to understand the durability of these immune responses over the next few months to years after infection.
And as far as those tests goes, the Mayo Clinic say they have decided at this point against using those rapid tests in their own clinics because of quality issues. Robin.
All right, Eva, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.